Hello and welcome to Conversations with Dr. Bauchner. It is Dr. Bauchner, Howard Bauchner, and I'm here with Mike Leavitt. Welcome, Mike.
Thank you. I'm happy to be with you.
Now, Mike, you've had an incredibly distinguished career, so let me go through it for our listeners because everyone may not be familiar with it. You were governor of Utah, 1993 to 2003. You were at the Environmental Protection Agency, 2003 to 2005. And then head of HHS from 2005 to 2009. An incredibly distinguished public service career. Thank you.
Thank you. It was a privilege.
So, Mike, big picture, you were governor. We'll get back to what you think roles of governors are, the role of governors in these pandemics. But then you were also secretary of HHS. What's your sense of what the last 3 months has been like in the United States?
Well, I should probably give context here.
Okay.
I had been Secretary of Health for about 4 months when I was briefed by CDC about a potential pandemic virus, the avian influenza H5N1.
Okay.
And after some deep investigation, I went to the president and said, we need to prepare for this because we are poorly prepared. He supported that idea. We went to the Congress, got $7.1 billion,
Wow.
and I spent the next 3.5 years developing a national pandemic response plan. That plan is actually the foundation of what we're operating under today. It was used in the Obama administration, iteratively improved. But what we're going through right now is something that has been planned for many years, and it was a means by which I gained some insight on this subject. It became clear to me that there is a role for everyone in a pandemic, different than any other emergency that we plan for. When I was involved in Katrina or in 9/11, the response of the federal government was call the states. Get the states to send their emergency assets to the region of the emergency. In a pandemic, that's not an available option because it's happening everywhere at once. I mention that just to remind us all that this is a uniquely local emergency. The federal government has a profoundly important role, but it's not the only role. There's a role for everyone here.
Mike, when you look back on that experience, the H5N1, and the resources that you were able to obtain from Congress, and then how that rolls out over the subsequent years, what worked then and could have worked now?
Well, let's acknowledge that the pandemic that I was directly involved in really amounted to a planning exercise. And every one of these is a bit different. But I think it's very important to acknowledge that, again, as I said, there's a role for everyone. The federal government has a vital role, and it's important to acknowledge what it is. It starts with things like medical countermeasures. Only the federal government can develop vaccines and antivirals and judge them as effective and safe. Only the government can deal with the monetary system and the problem of keeping the economy alive during a period of pandemic. Only the government can gather the resources necessary to bolster what's happening at the state and local area by sending them money. Only the federal government can provide situational awareness by being able to develop data and coordinate across the platform of 50 different states. So there's a very robust, essential set of duties for the federal government. But in the final analysis, each state has to take the available resources and be able to use its public health infrastructure to have boots on the ground. You can't expect that the federal government's going to ride to their rescue in every case. And we're seeing a lot of the discussion right now about the state and federal role. There's a role for both.
Do you think the federal government has done as well as it might have over the last few months? Now it's a pandemic; it's quickly evolving, but you have a very specific and important lens: history, a governor, and head of HHS. So both you're at the state level and the federal level. Do you think the federal government could have been more effective over the last couple months? Hindsight's always easy, but I'm curious about what you think about that.
Of course they could. I don't think any situation like a pandemic will not reveal serious flaws in many different systems. We are yet to see serious flaws. We're yet to see all of the serious flaws, I should say, in the American healthcare system. We're beginning to see it. We're beginning to understand that there are access issues, there are payment issues, there are lots of different issues that the exaggerated demand that this puts on the system will reveal. It will also teach us some lessons about how to respond to these things. The problem, Howard, with a pandemic is that anything you say in advance of a pandemic sounds alarmist. Anything you've done after it starts is inadequate. Yeah. In the course of time, we'll have a chance to learn what we did and what was inadequate about it, but we'll be able to look back and say, we didn't do some things because it seemed alarmist and we should have been acting. These things only happen every 30 or 40 years, and they skip generations. And so entire generations of leaders are not aware of what a powerful reshaper of the world these become. They not only shake the healthcare system down, they change the economics, they change the politics, they change the social makeup of not just a country, but the world. And that's the history of pandemics.
In this pandemic, what do you think governors could have expected from the federal government and should have assumed that they needed to do on their own?
They should have been told, in my judgment, right up front, look, there are 5 or 6 things the federal government has as specific roles, and we're going to concentrate on those and do them very well. Then we would expect that there are things that you're going to do. We'll do all we can to help you, but here are the things we can deliver on, and we're going to deliver them. And one of those things is coordination. One of those things is supporting the states financially. One of those things is using the stockpiles we have. However, those stockpiles, I was involved in their development, were built for the emergencies that happen every year. The windstorms, the earthquakes, the occasional terrorist event, disasters that are regionally confined. So we have 12 stockpiles, but they're developed in a way that they can deploy supplies to a regional area. They were never designed to be the supply for every state on an ongoing basis. Now, this is not just a function of lack of preparedness. It's really a function of lack of understanding on the breadth of a pandemic. Now, I am highly sympathetic to a governor who finds themselves without resources, who naturally turns to the federal government. And I'm not sure the federal government's done the best job of explaining to them why they have limits on what they can do to respond. But nevertheless, there are very active limits at play here, not just in geography, this isn't about having a lack of will. It's not about a lack of wallet. It's a lack of the logistic possibility of having the federal government serve everyone at the same time with the same assets.
You must have been proud of some governors this past week who I think really were instrumental in saying we need to share resources between states so that states can't, for example, hoard ventilators, but that governors were very insistent that that ventilators be shared with other systems that were under stress. I've been surprised it hasn't happened sooner. But you must have been proud of governors.
Yeah, I'm proud of what they've done. That's the right thing to do. Now, candidly, in the hot wash that takes place after this, there ought to be a discussion about actually FEMA, in the right design, becomes the coordinator among and between states. And I think governors got frustrated by the fact that that wasn't happening fast enough. But again, we're in a real-time emergency, and I think those governors sharing resources was A, the right thing to do. B, it was a necessary thing to do. In a war, And make no doubt about it, we're in a war here with a virus, a cunning, difficult enemy. You've got to act like a network and be able to begin to exchange assets and change your shape and find ways to innovate and do it quickly.
When you think of a countrywide pandemic, not isolated catastrophes that happen with hurricanes that are more local or even earthquakes, but an infectious pandemic, obviously, in this case, has engulfed the entire country. We need a committee, that pandemic disaster committee. Do we need a captain of the ship who can oversee that committee, but also then help the CDC and the FDA and the executive branch to cooperate? Do we need a czar of some sort?
I hear that argued, and I think that would work only if that person came endowed with all of the power required to make it work. If you're in that role, you've got to be able to say to the Secretary of Labor, I need the following three things done. You need to be able to say to the Secretary of Education, the following things need to be done. You need to be able to say to the Secretary of Health, we need the following three things done, and have it carried out. And the only authority that allows that to occur is the direct and total delegation of authority to the president. Now, the president obviously has to say in charge because the president was elected by the people. But if you're going to have that kind of central authority, that person has to have the kind of authority I've described in order to make it any different than any other time or place.
Given our Constitution, under certain emergencies, is that even possible, Mike? I mean, that's what I've thought about, but I haven't really thought about whether it's even legally possible. Like someone could oversee the FDA and the CDC and the other branches that you've talked about. Is it legally possible?
Yes. The president can delegate on virtually any authority within the executive branch as long as it's understood that accountability comes back to the president. The issues become when you start going between the states and the federal government. There's a lot of people who've said, look, the president ought to just close all the schools.
Right.
The president doesn't have that authority.
Right.
Some people say the president ought to go into lockdown in all 50 states. The president of the United States does not have that power constitutionally. People have said they ought to put certain groups of people in quarantine. That's not within the constitutional scope of the president of the United States. Not even the Congress could do that because this is a constitutional government. So I think this is not just a function of authority. It's also a function of how do you achieve a common result in many cases in a collaborative way. And we've got a lot of that in the next little while to learn particularly as we begin to figure a way to emerge out of a pandemic.
Do you think politics has made it worse, Mike?
Look, we're in a time when the hue of politics just sort of casts itself over the entire atmosphere. I think that people have been pretty well behaved, candidly, through the early course of this. As we get into the late summer and early fall, I think we can count on the fact that politics is going to not just be a hue in the background, it's going to be very pointedly present. I'd like to think it wouldn't, but look, this is human nature. This is a democracy where people act, and we're dealing with specific people and who all have their own objectives. I'm sure it's going to become part.
Can we go back to the role of FEMA? There's quite a few questions about that. Does FEMA have the capacity to move resources around the country?
Yes, that's actually FEMA's fundamental role is to coordinate among all of the various components of the emergency response. Now, FEMA has a limited capacity to petition assets from a state, but they have a lot of leverage to get them to do what they need because they've got, in many cases, the purse. They can They can use that as a means of doing it. There are certain emergency protocols where states have agreed in advance with reciprocity agreements. So FEMA is the agency, in my judgment, that is tasked with the role of coordinating the use of federal assets. It's a hard job, and I'm not in a position here to grade how they've reacted, but it's a hard job. It proves hard in every emergency. You can look back on no matter what it is, but doubly difficult, maybe 10 times as difficult in a pandemic.
Do they have access to those 12 stockpiles?
They clearly have the ability to. Those stockpiles are run by HHS.
They're run by HHS.
But that's a function of being able to actually inventory them, keep them safe, know what's in there, know what gets deployed. That's the management of that. But in terms of being able to deploy it, there's a national emergency response plan. And under that national emergency response plan, the coordination role clearly falls under FEMA.
New York, Boston, Detroit, New Orleans certainly have struggled more than other metropolitan areas. Things are better in the Bay Area. Seattle has managed. They may be over the worst of times. Philadelphia, Atlanta, Salt Lake City, much less of a struggle at the moment. I think there's some hope that the social isolation, the distancing that was implemented in many states 2 or 3 weeks ago is really now paying dividends. You already mentioned that the ramifications are substantial and long-lasting. What do you see the next 3 to 6 months looking like, and then 2021?
Howard, I think anyone who believes that this is a one-and-done problem is engaged in wishful thinking. It just contradicts biology,
right?
The way a virus works. We're going to go through a process where we weather these hotspot peaks, and we'll get through them differently in different communities. Then we're going to start releasing the social distancing requirements, and people are going to go back to a sense of normality, and it's going to be a fresh breeding ground for the virus, who is looking for new hosts to invade. And we're going to see, as we do in every pandemic, the likelihood of a second wave, maybe even a third wave. So what we're looking at is a new risk that we are beginning to cope with, or having to cope with now during this period of time. And this is probably a multiple year proposition, not a multiple month proposition. And it's quite likely that we'll end up doing what infectious disease and folks are referring to as intermittent social distancing. It's very possible. I live in Salt Lake City. I fly to New York or Washington a lot. I always check the weather. And often there will be a winter storm warning, and they're just going to close that city down, so don't bother to come. I think we could begin over time to see a different kind of warning. It could be a COVID hotspot warning, where we're all going to have to go from green, if you will, to everything's a go, back to yellow, and we're going to have to start doing things that fall within that bucket of social distancing. This is not a short-term proposition. We've got a virus. This is being defined not by the Congress, not by either party, not by anybody's wishful thinking. We're up against a cunning virus, an element of the natural universe that is looking to invade any host it can. And we're going to have to fight it until we get it small enough that it can die.
That notion of green, orange, red, I travel to China quite a bit, or I used to travel to China quite a bit, but I wouldn't go certain times a year because of air pollution. And it would be red. The U.S. Embassy would put out the air pollution alert. And I would go, I'm not that interested in going that time of year because it was red. I would generally wait until it was at least orange, potentially green. Mike, do we have the public health service that we need? as we move away from this kind of centralized hospital-based pandemic, and we're going to talk about trying to track and trace and potentially quarantine in ways that we haven't been able to do in the first few months of what's happened, do you think we have the public health infrastructure that we need?
No. Public health has been a stepchild in the healthcare system for the last 50 years, and we're paying a price for that. And this is something for those who are constituents of your publication, I think, to give long, thoughtful consideration to. This is going to bring public health very much to the forefront. We're moving into Public Health Day. It's not just pandemic and infectious disease. It's also things like the social determinants of health, because we're all having to change how we get paid. And we're realizing that unless we can get upstream to be able to change the health of Americans, we may not make that work. Well, who has those skills? Oh, it's public health. Who are those people? I am amazed when I go from state to state meeting with large medical systems, how often they don't even know who the public health people in their communities are. So I think the public health in every state now has got to become a much more prominent part. I think it's going to become a big part of the way our nation now relates to others. Health is a great ambassador, and everyone now is going to be concerned about how do we keep America and our allies healthy, and what can we do to help people who stay healthy that we want to have as our friends.
I'm concerned both about the economic well-being of small practices as well as hospitals, but let's start with small practices. I was talking to one of our associate editors. His wife's an ophthalmologist in Maine. Her practice has essentially closed. She still wants to pay her employees and herself. I have an old medical student colleague who runs a really sophisticated cardiology practice in the Maryland suburbs. Many of the referrals go to Hopkins. They have essentially closed. They're not paying themselves. They want to pay the junior cardiologist as well as a fair number of their 55 employees. How do the small practices survive over the next 3, 6, 9 months?
There's very real reasons for them to be concerned, as alongside every other small business in our economy.
That's very true.
And so I think, first of all, they have to be willing to take very quick action. Now, we are grateful, I suspect, universally, that we live in a place that can step up and help in moments like this. I mentioned that one of the roles of the federal government is to try to preserve the economy. And they acted. And you think about the miracle of the fact that Republicans and Democrats came together in 10 days and acted to the tune of $2 trillion. That's, we're just not accustomed to numbers like that.
Printing a lot of money.
Yeah, $350 billion of that is going for small business, and it's going to be inadequate. But the first thing I would say is get in line and put your submission in for payroll protection. Look at the other benefits that are available. Secondly, I would say act. If your business is going to be substantially smaller over the course of the next little while, then there are ways to work with your employees to say, we're going to have to furlough you, but we want you back. And here are assets that can be used during the interim, or they can begin to look at how you can use part-time status. There are a lot of different tools. But the important thing is to act to preserve your viability during this period. I'm actually involved in the creation of, or the discussion on this with large groups of small businesses. Earlier in the week, I did a podcast similar to this that was aimed at small businesses. We had over 3,000 small businesses in one small state respond to that, and we're all. I mean, I am a small business owner, and I'm having to do some very bold things to keep myself alive during that period.
Now, you're in Utah, so you have the University of Utah Medical Center. We already talked about it. You know, you and I both know Vivian Lee, who was the former CEO. And then you have Intermountain. Now, they're different in the sense they have reserves. Many, not all, many have really curtailed the rest of their business life or the healthcare they deliver. So they certainly have, for those that have done that, they certainly have short-term losses. They may be buttressed by income from all of the patients with COVID ID. How it shakes out over 6 months or a year may be unclear. They will have pent-up demand that they'll have to try to deliver as soon as there's waning in the pandemic. How do you think the large hospital systems may react, or what's their future look like to you, Mike?
I think every system is going to be stressed. Everyone. They'll be stressed by lack of capacity during peak periods. They'll be stressed by the fact that they have eliminated all elective procedures and that their income has been dramatically cut. They'll have a lot of practitioners who are either part of the system or reliant upon the system whose practices will be dramatically scaled back. But I acknowledge that you walk up and down Main Street right now, and that is the situation with virtually every business in America, except a very small number of what have been deemed essential. We have never done this before, ever. There is no experience that parallels this, where we have literally flipped the switch on the economy, and for a period of some number of weeks, we have scaled it not just a little, but a lot, and not just over time, but overnight. Now, so there's a lot unknown here that we're all going to be figuring out as we go.
You know, I'm sure you're aware before the pandemic struck, there was a great debate about the U.S. healthcare system, its cost, 18% of the gross domestic product, a slight increase in the number of uninsured. And, you know, the four great systems of care in the U.S., Medicaid, Medicare, private insurance, and then the VA system. Do you see that shifting or changing because of the pandemic?
So I mentioned earlier that studying pandemics over time, as I have, it's become evident to me that pandemics change everything. They change the politics, they change the economics, they change the sociology of every culture they touch, and it's everywhere. So let's just think about what we're going to see happen. We're going to see a lot of hospital systems who will be providing care, a lot of physician practices who will be providing care that they're not going to recover from under a fee-for-service or some kind of value-based contract. They're going to be providing care in an exigent situation. And I think ultimately the government's going to come in and do their best to make them something close to whole. But that will be a matter of time, and it'll be ham-handed and not very exacting. But we're also going to see the serious limits of a system that does not provide care to people without a lot of bureaucratic stuff. And we're going to see a lot of discontent, not just with the healthcare system, but right now we're in this quite glorious, I don't mean that it's a hard thing, but look, there is a sense of national unity that is sweeping across the country right now. I mean, we are all doing hard things for the sake of each other. Now, there's a little grousing here and there, but think about it. This is a profound moment in American history. Now, those profound moments you think about 9/11. We saw this in 9/11. You think about it in Katrina. We saw it in Katrina. This is much larger, and it'll probably last a little longer. And there's a kind of humility that comes across when that occurs. But it'll end. And when it does, there's going to be people who are unhappy, and they'll look back and say it should have been done this way, and the politics will get in. And I think we're in an atmosphere where a lot of things could change. A lot of debates that we have just simmered under the surface. Could we see a big change in the healthcare system? I think we could. I'm not predicting it, but the atmosphere for this kind of big change is what a pandemic does.
I've been talking to Secretary Leavitt and Governor Leavitt. Mike, do you go by governor or secretary? We were trying to figure out. I was talking to people in the office, and we are going, which trumps which? Does one trump the other, Mike?
Well, Howard, as we talked about, my mother and father named me Michael. My friends call me Mike. But I did find something interesting when I left. People would ask me that question, and so I did a little research. And when a title is required, someone decided that if you get elected to something, that title sticks with you. If you get appointed to it, then it's supposed to be left in the office when you leave. And if Emily Post were here, she would make clear that probably governor is the right title.
Well, it's funny. When I started at JAMA, people actually knew I was a pediatrician. Now they don't know I am a pediatrician. They just know that I'm editor of JAMA. What a pleasure. I've been talking to Mike Leavitt, who's had a distinguished career of public service. This has been Conversations with Dr. Bauchner. I'm editor-in-chief of JAMA. Mike, stay healthy, and I extend that wish to your entire family.
And you too, Howard.
Take care.